I talked about, well, if you don't, you have to have a way of understanding how much disease is in the population. And the way that we do that is we look for signs, and the signs are essentially the incidence of disease, the frequency of disease. I think you're all pretty much aware that if you have an outbreak, you go, oh my God, we've got a lot more disease in the shelter right now. But more subtle changes happen that aren't necessarily an outbreak that you may be missing. And you're certainly missing the opportunity to watch the trend downward in the frequency of disease if you're not monitoring how much disease is there. And for those of you using PetPoint or Chameleon, those programs are facilitating the collection of disease data for you. And it doesn't have to be highly sophisticated. It could be, this cat was diagnosed with upper respiratory on January 2nd, and just enter that. And by the end of the month, you can count up then how many animals developed upper respiratory disease in that shelter for the month. If your denominator doesn't change, that is, your intake doesn't change much over the years, you may be able to just use the number of sick animals. If you've got real variations in the number of animals coming in, then you may have to adjust and actually calculate rates rather than just numbers. But start off simple. You don't have to do anything really sophisticated. It's just sick. This animal is sick. This animal has upper respiratory disease. This animal had diarrhea. And just tag it. And if you don't have a computerized system, frankly, you can do, and we did this at Tompkins County years ago when we didn't have a computerized system, is that we just kept a little log, a little book, that you could tick off how many animals were sick.